This original WSRE presentation is made possible by viewers like you. Thank you.
Good mental health is a critical part of overall wellness. Unfortunately, we hear about and often encounter serious mental health issues just about every day, as well as the small stuff. In our nation, it happens in our world and here at home. Is there any hope for us? Well, the short answer is yes, and we'll talk about that as In Studio begins right now. Hope, the pathway to good mental health. That's our show topic this evening. In previous broadcasts, we've discussed integrative physical health and we've addressed recognizing addictions and help for those issues. Tonight, we've invited two experts in the field of mental health to assist us in tackling some of the big questions of existence and how to best navigate our lives. We welcome to In Studio tonight someone you'll recognize from our previous show on addictions, Bruni Emanuel. He's joining us to help delve a little deeper into the subject. Bruni holds a master's degree in counseling and human development. He has designed, implemented, and managed addiction treatment programs for over 40 years. Bruni Emanuel is currently the director of the Men's Residential Treatment Program at Pathways for Change. And Dr. Timothy J. Donovan. Tim has been working in the field of mental health in various capacities for 30 plus years. Tim has a degree in psychology, a master's degree in counseling psychology, and he earned his PhD in developmental psychology. His professional experience is vast, specializing in depth psychology, professional development, group training, vision groups, and much more. Dr. Donovan is presently working with his private clinical and consulting practice. And so I want to welcome both of you to the broadcast, and I also want to say before we get started that viewers may wish to grab pen and paper for tonight's broadcast. I imagine we will touch on topics that will inspire further thought as well as possible additional research. And you know, really what I'm thinking is this is kind of like a free hour of therapy because I think you both like to work with individualizing treatment for people, and we have a big group of people that are collectively watching us tonight, so let's see what we can all take away from it. So thank you again.
Good.
Yeah.
Glad to be here.
So we talked about entry. What is entry? And I'll ask you first, Bruni. We talked about that in our previous conversations.
Well, there's so many ways of accessing help for mental health issues that you're having, or your family members are having. But so often what happens is between the stigma and the shame, it doesn't happen until it gets to a crisis. And then if we're talking about a family, usually there's an identified person who's sort of having to carry the cross, to use Tim's words, for the family, because there's just as much work that needs to be done with that family system as there is with that identified patient.
What are your thoughts on that?
Well, along with that, just the common everyday issues that we all deal with, anxiety, mood issues, changes in mood, depression, sadness, grief. Grief is a big issue for almost all of us, and if we can't grieve our losses adequately, it turns into depression, and complicated grief is what it's called at times. And so grieving is a kind of suffering of the pain of losses and doing it consciously and going through it. And a lot of times we need help with that. That's just an example of a common thing it's not an illness.
Right.
It's an experience that everybody is familiar with. We all have losses and disappointments. And then, of course, the family system is the focus, as Bernie was suggesting many times. A lot of therapists prefer to work with the whole family if possible. For example, when parents contact me about issues with their children, I typically, after talking to them a while, will say something like, why don't you all come in, the parents come in, and let's talk and see how it goes. Typically, as they work through their issues, the kids get better. it's a miracle, you know. So that's, and sometimes if the kids are older, or even some of the younger kids, they'll come in with the whole family, you know, after the parents have worked through things and they've had a little coaching on how to deal with the children. So the typical context of mental health issues, stress, grief, loss, is marriage and family, the context of marriage and the family. And so marriage and family therapy, the number one reason people come to therapy is for marital problems.
They say that's the most difficult relationship there is, right?
Absolutely, yeah.
How important is it to get that right? I mean, we're going off topic a little bit, but how important is that?
Well, it's right on topic because the marriage, we all know, and family is the center of our culture. And to have a healthy culture and society, we have to have healthy families and marriages. And so marriage is obviously a challenge. And one of the things that happens with marriage is the honeymoon ends and reality hits. And we have to deal with the issues that both parties bring to the relationship, the past issues, their own history, their own grief, their own issues that might not have been very much understood in the beginning of the relationship. It just wasn't the focus of the relationship. And so these things come out after people have been together for a time, or say they have a child, and it brings out things that you know they didn't expect.
So it
Or a
affects
major loss.
Right.
So
Absolutely.
often when a loss
Right.
happens to a couple, you know, it's just so, it shakes the foundations.
A change, or
Right.
you know, like
The thing is that we have to go through those things. You know, life gives us these things, and sometimes we try to avoid them. We avoid them with substances, with behaviors, with all kinds of things. I mean, I don't know why life is set up this way, but the way it is if I've got this going on, I've got to go through it to get to the other side. And to me, that's a reflection of the spiritual reality, kind of like what Jesus had to do. He had to die to be reborn. And I think that's a metaphor for what happens with all of us in our growth. We have to go through it in order to get the skills to be able to deal with it.
So pain is scary, and how do you get somebody to say I'm gonna go into that, because that's like the last thing they want to do.
it is. Phil Stutz, a psychiatrist who writes about this, interesting story. He wrote a book called The Tools, and Bernie's probably familiar with this. I brought it into the Pathways for Change family and community as a teacher there, as a consultant. And one of the things I did and have done at Pathways for Change is to teach the resident therapists there, the interns, and consult with them on their cases in a clinical forum. And so I would tell the residents, I said, this group is part group therapy for you. It's case consultation, and we're also studying the organization, as you know, because it is a clinical organization that provides counseling and clinical services to the community.
So you two have worked together.
Yeah.
You've known each other a long time?
Well, since grade school.
Long enough, yeah.
And so you both went into this, and we're seeing more and more people willing to talk about their daily issues, their stress, their anxiety. Some people have family members that wind up with a diagnosable illness, an addiction, or something else. So there's really, does anybody get out of this?
No.
I don't know.
It's
anybody
100.
here.
It's 100%. I mean, we all struggle with these things. It's part of being human. If you know, if you live long enough, and so as we were referencing before, pain is part of life, and emotional pain and loss and developmental pain, growth means that we're going to have to face, none of us probably liked starting, going to kindergarten the first day, or preschool or whatever, and you see the image of your child when they were young and you brought them there clinging to your leg, and crying, the separation, that going into the world as a preschooler even, that's traumatic, but it's part of development. It's part of growth. That's part of our culture. It's a pretty good bet that pretty much everybody in our culture went to school at some time or another.
Why do you think people are more willing to talk about it now, though? Because there was a time when you didn't say you were going to a counselor, or you weren't going to therapy, but have we gotten to a point where we've grown more as a society, as a culture?
I think there's some very positive benefits to the reality that we have instant information on a global basis now. There's some wonderful aspects of that, and one is that we see people talking about things that we may never have talked about, and that expands us. There's also negative sides to that information. I don't think we as a culture really understand some of the challenges with having too much information.
Vicarious trauma. You watch the news, who could watch every news program and not be traumatized by it? You have to have a healthy diet of what you take in, information, and screen it. And, we don't let our children watch just anything. And we should also be thoughtful about what we take in.
Ingest, really, right? Every bit of it. And I've heard a lot of people that say they can't listen to certain music anymore. They have to hear certain things. Is that a self-protection kind of thing that everybody can practice?
Absolutely. I think we all have to set limits on that. Going back to your original question about has it changed since Bernie and I were at Sacred Heart Elementary together on 12th Avenue, a lot has changed. I don't think I was introduced to psychology at all until I went to college. And that was an opening of something that I didn't even anticipate. And I didn't go to study psychology to college. I'd never heard of it. But I think being raised in the Catholic tradition had a kind of sense of that. There was the mystery of that was very akin to what we call the unconscious mind in psychology, the deeper self, the soul.
And I hope we can spend some time here talking about that mystery.
All right, well, let's do that. We're going to take a break right now, and when we return, we'll continue our discussion of attaining good mental health with our experts in the field. You're watching in studio on WSRE. We'll be back in a moment.
Education really does ensure school success later on and life success. So many children actually do not get a chance to get high quality early education. Low-income families start with so many risks and barriers.
High-quality educational media can have a positive impact on early learning, especially in low-income communities.
The most critical years are from birth to 5. That's when most of the brain development takes place.
Early opportunities in language arts and reading and math provide the foundational understanding for success later on.
And this is where PBS Kids can play and does play a huge role.
PBS Kids content works. And our research has shown that kids have made positive and significant gains in their mathematics learning after using PBS Kids content. It's actually really amazing. There's a lot of active learning going on. They're problem solving together. And we find that using the PBS Kids content has really empowered parents and made them feel more confident and able to help support their kids in their learning.
As a working single mother, I need all the help I can get. PBS Kids helps me as a parent reinforce the values that are important to me.
I think that PBS Kids certainly recognizes that they're onto something here. Whether it's TV or the app or the games, you have that whole palette of opportunities for children.
School readiness is important for not only the child, It's important for the family, it's important for the community, it's important for the nation.
Welcome back. We're continuing with In Studio tonight's topic, the many aspects of achieving good mental health, the pathways for hope, if you will, that are available for those suffering with mental health issues as well as their families and society. So thank you to Dr. Tim Donovan and Bruni Emanuel for being here with us. Appreciate your time today. So we've talked about reaching as many people as we can with this important message of everybody has pain, right? Everybody has issues. Let's go into how do we deal with these things, from the littlest of the headaches to the stress on the job to the addictions to the psychoses to the, I mean, is there a spectrum?
Well, we talk about stress. Everybody knows what stress is, and it's kind of a catch-all for anxiety, tension in the body, even physical symptoms are often, about 80 or more % of what primary care physicians see in their office doesn't have a physical cause.
So that would include cancers. That would include.
No, I'm things that they have no physical cause. They're emotionally caused. They're stress related.
But they've been manifest if 80%.
But they manifest in physical symptoms. So they go to a physician and they get treatment, but they're not treating the source.
I gotcha.
Yeah. So and that's a common. I taught in the family practice residency here until it closed for years, and so I taught the medical residents how to deal with the patients in a way that would get to some of those underlying issues that were causing the physical problems. It's very hard to do, though, in medicine because of the limitations of the time that the physicians are allowed by the payers, actually, to spend with patients. It's very regulated by, insurance reimbursement.
And so how do you take care of those types of issues? I mean, if 100% of us need to be helped, and that doesn't, and we're talking about good mental health, but really what we're talking about is just the overall fact of life of what everybody.
The way that we talk about it a lot at Pathways for Change is being healthy in body, mind, and spirit. And the issues that are being manifest may show up in the body, as Tim pointed out, and sometimes they're not. They show up in the mind that we're forgetful, we're not able to continue to do some of the things, and then also in spirit that our sense of hope, our faith is shaken to the core. And again, I would emphasize to folks that are watching that you can't avoid those physical, mental or emotional, spiritual issues that you're dealing with, that they're being given to you as an opportunity for your growth. And how do we address them holistically and separately? And that's our challenge. And practice is, how do we do that?
And how are we doing that? What are some of the different ways that we're doing that?
Well, in general, with psychotherapy, the main modality is going into the pain in a positive way. And one way to look at it or think about it is that we confront the emotions that are creating pain. And we let those emotions tell their stories, so to speak. Find the meaning in it. What's the message? Emotions are not random. They're meaningful. So those feelings that are getting our attentions, creating symptoms, stress, pain, going into the pain, and a magical thing happens when you go into the pain in a caring, feeling way. There's a reversal, and the pain changes into a strength. You know, we all know people that overcome great adversity, and we admire them, you know. People that had addictions and are now sober, and not only that, they're helping other people. They're sponsors in 12-step programs. They're functioning as counselors and guides to people coming up. And what's their pedigree for doing that? They've been there and done that, and they've overcome their own pain and transformed it into a strength, and they're going to show other people how to do that.
I imagine it's hard to tell people, particularly in these residential programs, that if you will go into your pain, then we can overcome this addiction. So let's go there.
Yeah, that is hard. Vulnerability, humility, willingness to do this, yes, that is the hardest part. And for me, in the setting that I'm working, it's a 18-month-long program, and oftentimes that willingness needs to be manifest early, because there's deep work that needs to take place. Oftentimes, trauma precedes addiction, and trauma is oftentimes not, it didn't happen to me. It happened to mom and dad or to grandparents, and if they weren't able to resolve those things, guess where it's going to show up?
We touched on that a little bit last time. And so you've studied this at great length. You both have. And we did discuss this a little bit, but let's talk about that a little bit more. How could that be that my grandmother was depressed, so she didn't resolve it and she's going to pass it to me? I'm not saying I'm depressed, but I'm saying that's what we're talking about.
Right. And I'll reference Carl Jung, probably the most brilliant psychologist of modern times. To my mind, he is. And he said, the unlived life of the parents, the unfinished business, is passed down to the children. So trauma, loss, unresolved grief, as I was talking about, very common. The generation before us, my parents' generation and your parents' generation, they didn't talk about these things. I can guarantee you. They didn't talk about the losses, the grief, the depression, whatever. And so it gets passed down from generation to generation. In it's karma in Indian philosophy and spirituality. And so we know what that is. It's the unlived life of the parent or the grandparent, generations. I mean, it can be passed down from generation to generation, and then these things come out in therapy, or they come out at different times. So,
so what's a kid to do? I mean,
speak the truth, even if it's the shadow part. It's the part that, I'm kind of ashamed of. I don't like to talk about that. But still having a safe place to be able to name those issues. I like that we're talking about multi-generational trauma, and I'm very excited about some of the advances that are happening in treatment techniques.
And societal trauma. You know, there's an interesting thing. I forget the author who wrote about the men coming back from war, coming back to the U.S. He says the reason that there's so many serious problems with post-traumatic stress with these guys and women is because the way our culture fails to deal with it. We don't know how to deal with them. We don't know how to welcome them back. We don't know how to help them heal. We expect them to jump right into a high-paying job or whatever. It's not going to happen. There's so much that has to happen. And having worked in this field, Bruni and I both have worked with veterans that have post-traumatic stress. And so some of it is cultural, is what I'm getting. You know, our culture not being open to helping people that are suffering in these
But again, I
kinds of
say,
ways.
in terms of the hope, our parents and our grandparents' generation, those men, and then it was only men, who went off to war, they came back damaged psychologically.
Right.
But we didn't have the term psychology, and we didn't have the term post-traumatic stress. You know, culturally, as you were saying, they dealt with that completely different. And then Vietnam happened, and that kind of changed the whole landscape. All of a sudden, it wasn't just everybody lining up and saying, yes, sir, and doing what the government said to do. And that kind of personal responsibility and personal decision-making increased. And now we're at a place where we're starting, thank goodness, we're starting to be able to understand the manifestations of the trauma in the person's behavior. And Lord willing, we're continuing to increase our effectiveness rate in dealing with those.
Well, you mentioned something about these eye therapies. I know talk therapy is big. There's pharmacology. What are some of the different modalities or availabilities for our society now that we've recognized these things to work on?
Well, we know a lot more about trauma. I think you're referring to EMDR, the eye movement desensitization and reprocessing. That's the mouthful there. But basically, it's really, I call it focusing with bilateral stimulation, but focusing on the pain in a caring, positive way, in a nurturing way, and rather than rejecting the pain is the key with trauma, because of the shame associated with it and the lack of understanding. But so focus, and the eye movement part is bilateral stimulation. You can also do it tactily. You can do it auditorily. I have a little. I used it this morning in my practice.
There's an app for that.
Right.
Well,
yeah,
and meditation is so big right now, and a lot of people are looking into that. What would you say to those people, and why is that so important?
Well, to me, meditation is about centering, and it's about tapping into our inner place of peace. And centering, prayer, meditation, those kinds of activities, I think, are wonderful parts of the menu of services that are available. What we try to do with our men is to use a number of techniques, but the one that Tim was talking about, the EMDR, I have very high hopes because it basically, if done well, it extinguishes the unresolved feeling that's intrusive, that you can't get rid of. I keep having this thought, I keep having this feeling, and EMDR is able to help change that.
It's amazing.
That's remarkable to me.
You can think of it as the healing of memories. Memories are not exact replicas of what we experience. They're interpretations of experience based on where we are in our mind and stage of life and everything else. Like a young child is going to have a memory that's that of a young child and an older person. So the healing of the memory, the reprocessing and desensitizing of it, so it's not so sensitive, it's not so powerful.
I would like to talk more about that, so I'm glad we have about another 30 minutes, but we are going to take a break, and you're watching in studio on WSRE TV, PBS for the Gulf Coast. When we come back, we'll continue our discussion. Stay right here. This is In Studio on WSRE TV. We're talking about mental health this evening. Our panel, Bruni Emanuel and Tim Donovan, are working daily in this field. We're going to talk more about those generational issues related to different disorders and addictions. I think we've covered that considerably, but we were talking more about these treatments that are wiping out bad memories. That seems almost resolving. Okay, so it's not wiping them out, it's resolving them.
Well, it's definitely desensitizing and reorganizing those memories so that they're actually not traumatic anymore.
So I'm hearing you say that we need to reframe the way we look at things. In other words, I've heard people saying recently, okay, everybody has stress. So if we can think that maybe the stress is good and not necessarily bad, and we look for the blessing within this problem, am I on the right track?
Well, one patient put it to me this way: the memory's still there. It was in color before. It's kind of just vague and gray now. It's not powerful. It's there, but not really. It's resolved. It's no longer painful, and even at the Veterans Hospital in Chicago, there's a psychologist who worked with bilateral stimulation with therapy, the EMDR type approach, and what he found is when he went. Once the trauma was resolved and you keep doing the work, what comes up then is connections with the spiritual world. Automatically.
Yeah.
Automatically. Many of these individuals, and this was discovered accidentally, but they kept going with the eye movement therapy, the desensitization, and what happened is that this one individual had a spontaneous kind of experience of a connection with his deceased father. And it was a very powerful healing thing that went beyond the trauma from war. And it was.
Do you see that a lot?
Oh yeah, but the thing is that person was not sitting there thinking, okay, I'm not going to deal with this. What happened was his or her anxiety or physical symptoms or emotional symptoms or relationships got to the point to where they knew they had to do something because it wasn't working. And so they accessed some help, and fortunately they were able to find somebody who had the techniques and the tools to be able to help bring them through that journey. And I think the hope of this program is that is so for not only severe trauma, but for the everyday way of dealing with life, that there are techniques and processes whereby we can be living a happy life and resolve those issues, whether they be physical, mental, emotional, or spiritual. And to me, that's the hope of this program and the hope of where we're going.
Well, I've heard somebody say recently, too, that hope is not necessarily wishful thinking. What is hope? And we're talking about this for everyone. Yeah, I mean, how do we make hope a concrete thing for our viewers? And when we talk about spirituality, is that available to 100% of the viewing audience, just the same way pain is available?
Absolutely. So even though a man might come into our program absolutely convinced that there's no God, he or she in this circumstance has been hurt, has been traumatized so much, maybe multi-generationally, that he is not open to a spiritual reality. Because he's not open to it doesn't mean that he doesn't have it or that he can't discover it. But the key is that willingness that we talked about earlier. How do we make the person willing to be vulnerable, to suffer, to go to the pain rather than avoiding it like meth is real good at helping with? And in our previous generations, alcohol was very, and still is, very helpful in dealing with.
For a short
temporarily.
time. Yeah.
Well, you know, that brings up the idea that there's a new understanding of depression as being pain that we're not willing to suffer. You know, that depression is a solution to the pain of avoiding the pain. We're not willing to go through the pain. We're not willing to grieve, for example. You know, the losses. We're not willing to, you know, like the men that Bernie's describing, they've had incredible losses, traumatic losses that they've had to deal with. Their innocence has been deeply wounded and lost. I mean, essentially, that's what we're dealing with our patients is their lost innocence of the child. And so we're calling the child back, that innocence, and restoring that. And to believe again, to hope again, that life can be good, that there can be love, that you can have real connection. That's a miracle. You know, that is...
That's why we do what we do.
Yeah, an incredible kind of... Yeah, that's the reward. When that happens with a patient or a client that we're working with, then that makes everything worthwhile.
So if somebody's clinically depressed, though, or clinically an addict, where do they start?
Okay, well, let's talk about depression first, because oftentimes what one needs to do is to ameliorate those symptoms with psychopharmacology. The thing is that meds can usually help more effectively on a short-term basis than on a long-term basis. There's exceptions to that. But generally, if you're able to help the person through psychopharmacology get to the point to where they're not experiencing that, oh, God, I hate to get up in the morning, and get that mediated, and then begin the talk process. And if they have that willingness again, then this can increase, that can decrease, and pretty soon, in theory, they can get to the point to where they're positively functioning without the meds.
And that's a good way of describing it. With, as Bernie said, people will ask me, should I take antidepressants? And I said, the way I look at antidepressants, they take the edge off the symptoms to allow people to function. They don't cure depression. That's
Then you can do the work, right? And
right,
I've heard,
exactly. You can do the work.
Right,
That's
and
the
I've heard
point.
you say that you need to go and live your unlived life. That's deep for many people. So,
For all of us.
Yeah. What exactly do you mean by that in a sound bite or two?
Robert Johnson, a Jungian analyst, wrote a book called Living Your Unlived Life. And it's an interesting notion that, so look at it this way, what you dream about is your unlived life.
Your passions?
When you, in your night dreams and in your daydreams, I guess, we dream about our unlived life. Yeah. When you start out in your profession, for example, you have a dream, you know, and then reality.
So your dreams are crushed sometimes.
Absolutely. If you've talked to anybody in any profession, there's a dark side to every profession, medicine, you know, whatever. I've had a lot of doctor clients say, I told my son or my daughter, don't be a doctor, because we're not allowed to treat patients according to our own designs and intuition. You know, the limitations by the healthcare system are just, you know, change the whole way that medicine is practiced. So just the point being, the unlived life is the grief over our dreams that we haven't realized, that we haven't lived. Okay? And so what we have to do is take those dreams into the spiritual world and live them there.
So you can imagine them? You know,
well, you give them to God, so to speak. That you take what you can't change in this world and you change it in the spiritual world. You know, if there's a problem, you know, a lot of problems we can't fix, but we take them in prayer or meditation, we take them into the spiritual world and we fix them there. We work through it there, and then we feel better.
Is that what we mean by let go,
that
let
makes any
God?
sense.
Yeah, in the 12-step fellowship, you're going to hear a lot of phrases, and then there's the actual 12 steps too, because that's what they do. They're basically steps of spiritual development, and anybody can work those steps who's willing to. And we come back to the initial context, willingness.
And sometimes it's a parent that will bring someone in. We've talked about generational things, and I heard you say one time that the line would be down the street if everybody that needed help sought help, but that the people that don't really need help have to come and go to therapy to atone for that,
it's hard.
basically.
I tell my clients, I said, you notice they're not lining up at the door. It's not easy to cross that threshold and to ask for help. That's the hard part. I'll tell you, if you can, most of the people who therapy didn't work for never got any. Okay, they got maybe 2 or 3. I'll ask people, have you ever? I always tell people, I want to be your last therapist. Okay, and then I always ask about. Most of my clients, now that I'm older, have seen other therapists in the past, and I learn a lot from that by asking what happened in that therapy, and then but for many people, it's like, yes, I went to a therapist. I saw him 2 times. Okay, you didn't go to therapy.
That's not really work.
That's not really therapy.
Right.
It's like
but for the
false start.
Right, but some people say I can't afford therapy, or I'm not so bad that I have to go to. Where do those people seek help?
Yeah,
Bernie?
the financing for all kinds of health care can be challenging, no doubt. I'm so proud of Pathways because we have an outpatient center that's on a sliding scale for people. And there are other places, but the way to access that information is through 211.
211, and we'll tell people about that again too. But and we've got less than a minute here. The challenge is to show up.
Absolutely. I think it was Woody Allen that said 80% of success is showing up. If people show up, good things happen. If they don't, not so much. It's like work,
Got to be there.
That's right.
That's why it's called doing the work. Well, you're watching in studio on WSRE TV, PBS for the Gulf Coast. We'll continue with tonight's topic, Hope, the pathway to good mental health, right after this break.
WSRE is celebrating 50 years and remembering the show that gave the station its largest audience. Not Julia Child, not just a French chef. For 17 years, Earl Peru mesmerized viewers with classic recipes celebrated on both sides of the Atlantic. The New Orleans native crisscrossed Europe and Japan to study under some of the world's best, then shared his passion with generations of aspiring chefs. That's because gourmet cooking was their classroom, and it was yours. Gourmet cooking tempted viewers with irresistible recipes, many rich in local history. Earl Peru's Gourmet Cooking, the first WSRE production to air nationally from the station celebrating 50 years.
Welcome back. This is In Studio. Our guests this evening, Tim Donovan and Bernie Emanuel. These counselors help others in our community all the time, and tonight they're helping us understand more about seeking good mental health. And we've talked about spirit. Are humans having a spiritual experience? Are spirits having a human experience? What is it?
Yes.
Both?
To me, both are true. We were talking about addiction earlier. So often I've heard people who have really done the work and have achieved a level of recovery talk about looking back and seeing their addictive process as sort of a spiritual quest, trying to find a meaning, an experience that they hadn't previously been able to. only to discover that the substance can only give it to them temporarily. And then what ends up happening is they go through that 12-step process and they get to the point to where they find peace. It takes work and it starts with willingness, but that's the exciting thing to me. In fact, I know a guy that I've worked with quite a while who says that he's grateful for his addiction. And when you hear about his life and all the tragedy and all the loss, and you just kind of go, what? But without that growth medium of his addiction, he never could have transformed it into the life that he has now.
You know, a real easy thing I hear about, and it's so simple, is a gratitude journal, or even writing down 3 things. Even if you're miserable, you write down 3 things that you've found during the day. I see that in practice and with you all. Bruni writes an email and he says, "You can't believe the eagle's nest I saw earlier." And I appreciate that. Is that true?
Positive psychology has really come on the scene only recently, where gratitude, just thinking of 5 things you're grateful for will change your mood. And of course, David Stendhal-Ross, the spiritual teacher, Benedictine monk, his whole message was about gratitude and the transforming power of gratitude. So there are practices where we can cultivate positive emotions, and we can cultivate positive energy, spiritual energy in our power that is better than any drug in the world.
And how do you cultivate that positive mental energy? Because again, we've talked about people have daily little issues, and then there are the really big issues. And so for everybody, just
practice. My professor at Spring Hill, John Gasson, he was a Jesuit priest and a brilliant man. He said, the guy was walking in New York, and he was trying to get to Carnegie Hall, and he came upon this guy, kind of a panhandler in the street, and said, "Hey, how do you get to Carnegie Hall?" Practice, man. Practice.
So he was practicing.
Great story.
So.
I wanted to throw into something that you mentioned earlier, Tim, is forgiveness. I believe that the number one way that most people can grow quickest, best spiritually is to learn to forgive.
And that does not mean saying what somebody did is okay.
Absolutely not. Because I forgive you doesn't mean that I condone what it is that you did. But what forgiveness is it's a block to my process. It's not something about you. It's a block to my process.
I do it for myself because I have a right to not go on hurting in that way and suffering. In other words, I'm going to suffer through the process of forgiving, and that takes a lot of courage and a lot of strength, and it's spiritually very life-giving, as Bruni said, and transforming.
Don't all of the ancient texts in one way or another get to that same message of forgiveness?
What a coinkydink, huh?
Can you imagine that? So is that true?
Absolutely. So we talked about 2 of the key practices or tools are gratitude and forgiveness.
Right. And being with the pain in a loving, caring way. I know the same individual that Bruni's talking about, who says he's grateful for his addiction. That's a very interesting kind of take on things that really you have to digest that for a while, and what the blessing in the suffering, in the journey, And guess what? Every one of us has something equivalent to that.
That's right.
I guarantee if we live long enough, we have something equivalent to that struggle with addiction. They're not just the obvious addictions too, and I think we need to say something about that, to drugs and alcohol. They're process addictions.
Exercise?
Yes, and anxiety. We can be addicted to anxiety. We use it to control, it's an attempt to control pain. Obsessive thinking can be an addiction, again, to trying to control pain. So anything that we use to try to control pain can become an addictive habit.
So many things that we can talk about here in this next 6 minutes that we have of this broadcast. But I do want to reach as many people as we can with this message. We talked about addiction. You've used a phrase that it takes your spirit away.
Yeah, that awful feeling that I just can't do this. I'm a failure. Not only can't I do it, but I am the person who can't do. And that sense of shame.
I'm unworthy.
Yeah.
And it is shame, and I think I'm glad Bernie's talking about that, because probably a lot of us have heard about Brené Brown's work that has gone viral, and basically she was studying human connection and what got in the way of human connection, and she was horrified by what she found in her own research was that shame and vulnerability were the major experiences that were sabotaging human connection in people's lives.
And briefly, is that the same as the shadow?
That's a good question. It certainly could be. The shadow is kind of what I disown in myself, which is unacceptable, that I'm ashamed of, so I hide it. So there definitely is but it's also our unlived life. See, we were talking about living your unlived life. We have to integrate the shadow, or own our shadow.
But one of the ironies is, if I don't feel bad when I do something bad, in other words, if I don't feel guilty, that's not good.
Right.
People who don't feel bad when they do something bad, that's not a good thing.
Don't have a conscience.
Conversely, if when I do something bad, it's not that I feel bad about what I did, it's I feel bad about what I am.
Right.
That's the difference between guilt and shame.
Right.
We need to feel bad for what we do.
I'm unworthy.
But we can go through a process of atonement and forgiveness and reparation, as opposed to, I can't do that because I am bad.
Is this available to 100% of the people?
Absolutely.
So there are not any chips missing?
It's not about religion or atheism, or you do it or you do it right or not. That reality is available.
And the 12-step programs, I have to say, are amazing. They came out of the American culture. There was an influence from Carl Jung that is really kind of mystical, and so the 12-step programs do so much for so many people. It's an incredible adjunct to therapy, and the two complement. Any kind of therapy and the 12 steps go hand in hand.
But there are people out there who are having a problem with this conversation we're having because of some kind of conception of religion. That's not what we're talking about. Religion is an organizational way of dealing with the spiritual reality. The spiritual reality is separate from that. And it's just, to me, I would want to offer a word of hope. If you've been burned, if you've been traumatized because of the quote religious stuff, that's people. That's the instant.
There is religious trauma and spiritual
Absolutely.
trauma, no doubt, and that is treated in the same way as other kinds of trauma.
Right.
I'm hearing you both say that body, mind, and spirit, one will heal the other two. Let's talk about that a little bit more and expound on the issue of hope.
Yeah. Well, for me, in living my life, I try to read and to grow intellectually in my understanding of various techniques, processes, realities. My mind, I try to take good care of my body, and on a spiritual level, I do what I can to forgive and to have connection.
And Tim was talking about intuition, that voice. Some of the voices you don't want to hear, but there is one key voice that you know.
Well, it's your conscience, if you want to say that, you know, like Jiminy Cricket or what, you know, let your conscience be your guide. So we all have a conscience. We have intuition. We know, people always say, I knew I shouldn't have done this, or I knew, but we override it with our conscious mind, with our rational mind. We doubt. So in our culture, it takes a lot of practice to learn to trust our intuition. But once you can do it, I operate almost exclusively out of intuition as a clinician. That's,
okay. Well, we have about a minute, and talking about intuition. If somebody's enjoyed our conversation this evening and they want to know more, is there a book that you can tell us about that might be a good place to start?
I recommend the books by Robert Johnson, Balancing Heaven and Earth. He's a Jungian analyst, Living Your Unlived Life. He's written a lot. The Tools book by Dr. Phil Stutz and Barry Michaels, and The Power of Focusing.
Okay.
Unfortunately, I don't have just a list for you.
Well, that's a good one right there.
Those are just ones I recommend frequently. There are lots of books.
There's a whole section at the bookstore. Well, special thanks once again to our guest this evening, Dr. Timothy J. Donovan, who runs a private psychological practice for individuals, companies, and groups in Northwest Florida, and Bruni Emanuel, who is currently overseeing so many aspects of the men's residential treatment facility at Pathways for Change. We're so fortunate to have had this time with these friends and these experts this evening. So, in conclusion, there are many community resources available to help you or a loved one achieve good mental health. If you or someone you know needs help with mental health or addiction issues, please seek that support. Bruni shared with us on an earlier in studio about an easy method to obtain help or information. Callers can simply dial 211 for assistance. The number is on your screen, 211. Here, all the relevant substance abuse and mental health providers are made available. So those in need of assistance are referred and sometimes even connected to the appropriate agencies and community organizations. Bruni says it's a wonderful resource that's available to all of us. So we've been asked to, by many people, to explore the topic of addiction even further. People want to discuss legalization of marijuana, opioids, lawmakers, law enforcement, all of this, and how it's all being handled. So it's a continuing conversation that we'll tackle in a future In Studio. Until then, be sure to join Jeff Weeks on our next edition of In Studio. Jeff will be talking about Pensacola becoming an early learning city. That's in 2 weeks, Thursday evening, May 11th at 7 p.m. As more and more light is shed on the subject of mental health, additional people will seek treatment, and all of the people around them will benefit. And that's the hope, the pathway to good mental health. I'm Sherry Hemminghouse Weeks. I'll see you on a future edition of In Studio, or maybe you'll see me in your show, in our show that we call In Your Own Backyard. Until then, take care.